Bismillahirrahmanirrahim. Assalamualaikum and hi everyone. Our group will present about IT in health domain. My name is Fatinatul Fatiha binti Muhammad Idris and my group mate Nur Syahada binti Muhammad Nizar. We will present about the introduction of the domain, the example of application in the domain, the description of one or two application we choose in health domain, the advantages and disadvantages of using IT in the health domain, other related information that we can share, and lastly is the preferences. I will talking about the introduction of the health domain. What is the definition of application domain? Application domain can either be very extensive or very limited. We see application domains mainly in the context of commercial or governmental organization, but they could easily be in social or private organizations. Application domains include banks, insurance companies, or hospitals, which is the domain of health. The purpose of information technology in health is to provide better care for patients and help achieve healthy equity. As the pandemic of COVID-19 hits the world, our government in all countries is trying to cope with technology, which is they create an app that will help them in preventing COVID-19 from the worst outbreak that could happen. Information technology already supports a lot in the health domain even before this. Information technology in help improve healthcare delivery quality, increases patient safety, decreases medical errors, and strengthens the interaction between patients and healthcare providers. Besides, it is easier for us to monitor our overall wellness and doctors to treat their patients more productively.
These are the example of application domain in health. There are three example, which is MySejahtera, Smartwatch, and WebMD. Description of application: MySejahtera. MySejahtera is an application developed by the government of Malaysia to assist in managing the COVID-19 outbreaks in the country. They developed this application to assist the government in managing and mitigating the COVID-19 outbreak. Next, helps users in monitoring their health throughout the COVID-19 outbreak. Assist users in getting treatment if they are infected with COVID-19, and locates nearest hospitals and clinics for COVID-19 screening and treatment. Malaysian and residents of Malaysia, and also system administrator in Ministry of Health can use this application. This is how users can use the MySejahtera. First, user can install it on App Store or Google Play Store. Then they have to keep in all the information needed, such as name, IC number, telephone number, address, and update their health condition to make sure it not relate to COVID symptom. After that, user can straight away use it. User can use these apps by scanning the QR code at every store or restaurant that they went. Next is the description of device that used in health domain, which is smartwatch. We use Apple Watch Series 6 as the example. Okay, smartwatch. Smartwatch is a digital watch that provides many other features besides timekeeping. This device also equipped with various functions such as monitoring our heart rate, tracking our activity, and providing reminders throughout the day. So how does smartwatch relate to our health? Okay, a smartwatch helps in activity tracking, which is it track everything from steps per day, our heart rate, calories burned, and much more. Other than that, it also provide the short workouts, which these apps provide us with short interval workouts, easy to follow tutorials, and progress monitoring when you can read it from our wrist. Next, it allowed to set medication reminders. For example, for patients that live with chronic condition that required frequent medications, or anyone that's currently taking one, is essential to follow the prescription guidelines as directed by their doctor. As we know, Apple just launched their new watch series, the new Apple Watch series, which is Series 6. These are new features in Apple Watch Series 6. It provides the revolutionary new sensor and app to measure the blood oxygen level, which the new blood oxygen sensor is made up of 4 LED clusters and 4 photodiodes. Incorporated into the completely redesigned back crystal, this new sensor works in concert with the blood oxygen app to determine our blood oxygen level. In this watch also provide the heart rate app, sleep app, fitness app, motivation app, and much more.
Next, I will be talking about the advantages of ICT in health domain. The first one is increasing quality in patient assistance. One of the most important flaws of this sector is the fragmentation of healthcare and the difficulty for efficiently transmitting the information. ICT can help improve patient safety through direct access to the medical case story, checking the treatments online, keeping track of the patient's progress, and anticipating possible medical record errors. In general terms, they are regarded as generally positive to among professional and users. Since they provide a way to increase patient safety, their use is being promoted in many countries. The second one is cutting down medical spending. Using ICT for health help reduce this cost by reducing the time required to process data and manage paperwork. Image transmission and storage systems are essential to promote the electronic medical care story and telemedicine development since it speeds up the rest and result gathering. The second one is reducing administrative costs, which is invoicing brings about many possibilities of saving due to the use of ICT and new remote devices. Although the evidence of this data, electronic invoicing is not widely used in most countries yet. The fourth one is possibility to carry on brand new health models. ICT has been defined as the technology with a high transformative potential since it introduced new ways to carry out medicine and develop healthcare. They are definitely essential to renew primary health care since they contribute to a personalized following of chronic disease. They improve access to healthcare in rural populations, contributing to the optimizing data measuring and supervision. And the last one is improve spread of public health information and facilitated public conversation around significant health threats. Reliable information and effective communication like mobile telephony, emails, or video conferencing are vital elements in public health practice. Doctors worldwide may communicate with each other and discuss any health issue without leaving their home or office. Also, increased and more accessible information helps people with improving their own health. Next, I will be talking about the disadvantages of ICT in health domain. The first one is lack of attention to detail. Specific questions or concerns cannot be addressed solely through technology, but by talking to a medical expert. The second one is computer-based medical record are privacy concern. The records can be hacked, illegally downloaded, lost in a crash, or anyone attack the system of the hospital, and the risk of getting the data being stolen. The third one is nothing beats personalized advice and treatment from your doctor. While you can help identify possible medical conditions by researching your symptoms online, your doctors will never base your treatment plan or eligibility for disability assistance on a self-diagnosis. When you treat with a medical professional, he or she establishes your diagnosis and treatment plans on your reported symptoms, objective clinical findings, available medical research and guidelines, knowledge about your medical history and lifestyle. While artificial medical intelligence is rapidly developing and improving, it cannot replicate your doctor's skill. The next we'll be talking about is other related information. The first one is IoT, which is Internet of Things. Enabled devices have made remote monitoring in the healthcare sector possible, just like the Apple Watch Series 6, unleashing the potential to keep patients safe and healthy and empowering physicians to deliver supplementive care. It has also increased patient engagement and satisfaction as doctors' interactions have become more comfortable and efficient. Furthermore, remote monitoring of a patient's health reduces the length of a hospital stay and prevent readmissions. IoT also has a significant impact on reducing healthcare costs significantly and improving treatment outcomes. IoT is undoubtedly transforming the healthcare industry by redefining the space of device and people interaction in delivering healthcare solutions. IoT has applications in healthcare that benefit patients, families, physicians, hospitals, and insurance companies. The second one is blockchain. Blockchain is a technology purpose to address various problems in different domains, like in the banking sector, supply chain. Blockchain is a distributed public ledger that can securely hold primary records. Blockchain ensures that transactions can never be modified. Blockchain also provides data transparency, integrity, security, and interoperability to address the need for patients to manage and control their electronic health records. Blockchain technology could be successfully applied in the healthcare sector. Using blockchain, decentralized storage of patient information is possible. Health records which are up to date will be accessed by the authenticated user only. The patient can share his record with other doctors to diagnose disease, for example chronological disease. Thus, blockchain provides personal data transaction in the healthcare sector using blockchain. The third thing I will be talking about is the big data. Big data is massive amounts of information that can work wonders. It has become a topic of special interest for the past 2 decades because of the great potential that is hidden in it. Various public and private sector industries generate, store, and analyze big data with an aim to improve the services they provide. In the healthcare industry, various sources for big data include hospital records, medical records of patients, medical examination, and devices that are a part of the Internet of Things. Biomedical research also regenerates a significant portion of big data relevant to public healthcare.
In bioinformatics, it helps in the development and application of computational tools to acquire, store, organize, archive, analyze, and visualize biological data. Bioinformatics finds application in a growing number of areas, such as gene sequencing, gene expression studies, and drug discovery. For example, in medicine, bioinformatics can identify links between specific diseases and the gene sequences that cause them. The pharmacogenomics field uses bioinformatics data to tailor medical treatments to the patients who take them based on their DNA. Next is VR and AR. There, there are already many examples of AR VR adoption in healthcare, such as altering everything from the way medical students learn before interventional procedures to helping patients with PTSD and reducing anxiety in children undergoing blood tests or other painful procedures. A study by Duke University in 2016 claimed that virtual reality had helped patients suffering from spinal cord injuries in partially restoring their mobility. Next, in medical imaging, VR can enable better planning to support patient safety by reducing radiation exposure. The process of building a radiation therapy plan for patients is a very time-consuming, complex exercise. One has to plan a very detailed radiation dose distributions in 3 dimensions, not only taking care of tumor's complex 3D shape. They have to build a minimal margin around the tumor and at the same time spare the healthy critical structures from radiation doses, a root cause of many side effects of radiation therapies. VR has the potential to evaluate the dose distribution in 3D in an intuitive way, saving planning time with potentially greater precision and fewer side effects of the treatment. In conclusion, IT really helps in improve the quality of healthcare delivery, increases patient safety, decreases medical errors, and strengthen the interaction between patients and healthcare providers.